Welcome to our channel, Stoked Wellness. In today's session, I'm going to guide you through the art of providing a deeply relaxing neck massage. This is helpful for patients who experience a lot of headaches or carry a lot of tension in their neck and upper back. If you're ready, let's begin. I'm just going to begin with some gentle effleurage. I like to spend the first few minutes just warming up the tissues before introducing any deep pressure techniques. Using slow, rhythmic, and controlled movements will help to calm your patient's parasympathetic nervous system. When this happens, muscle tension decreases. Their body will stop producing so much cortisol, which is a stress hormone, which will actually help with muscle repair. It will also improve your client's pain tolerance, so you'll be able to get deeper into the muscles and provide better relief. The upper traps are the most common spot people hold tension, so you really want to focus on this area. Right now, I'm just picking up the upper traps. This technique helps to separate the muscle fibers and elongate the muscle. It will also increase mobility of the upper traps. To start introducing deep techniques into the neck and upper traps, I like to start with my knuckles, just with some basic muscle stripping, making sure that you are moving away from the head towards the heart. When you come across the trigger point, you can use muscle stripping or ischemic compressions to help reduce them. I like to do the ischemic compressions. I find it more effective. And what this technique does is it blocks the blood flow from that area that you're working on temporarily, which relaxes the muscle and toxins dissipate. When you're doing a treatment for headache relief, you never want to forget about working on the levator scapula. It's very common that people will get headaches from referral pain from trigger points in the levator scapula, especially if they work at a computer all day. So what I'm doing now is just starting at the origin of the levator scap and slowly running my thumb down the muscle. And as I get about halfway, I start to move the client's head to stretch the levator scap as I'm pressing on it. And you can start to feel the muscle tension release. After doing a couple deeper techniques, I just like to flush the area. And repeat on the other side. If your patient has a head-forward posture from working on a computer, their sternocleidomastoids on the front of their neck are going to be overworked. So to work on the left side, tilt their head slightly to the left and just grasp the muscle and hold on to it just the same as you did with the upper traps. And repeat on the right. When you're working on the cervical erectors, you want to make sure that your wrists are neutral, just to prevent injury, and just bend your fingers and press with your fingertips into the muscle as you glide up towards the base of their skull. Pause when you get to the nuchal line or the bottom of their skull. If your client's head relaxes in your hands at this point, you can lean back and pull, doing some traction to their cervical spine. You can even start by shoving your hands under their shoulder blades and then gliding up to the base of their skull from there. And this feels really good, especially for people that stare at a computer all day. Don't neglect the pecs if you're working on someone who gets headaches. The pec major and the pec minor, if they are tight, will start to pull on the front of the shoulders and will actually contribute to a head forward posture. This area is usually sensitive, so just make sure that you check in with your patient when you start doing deeper techniques. When stretching out the pec, make sure that their palm is facing towards the ceiling, so that you stretch all the muscles on the front of the shoulder. If you're stretching the pec major, bring their arm higher than shoulder height. And if you're stretching pec minor, bring their arm just below shoulder height, but still ensuring that their palm is facing the ceiling. And then just grab the pec muscle like you did with the upper traps, pushing the thumb under the pec muscle to reach the pec minor. You can just pick up and shake, because the shaking will relax the nervous system and will relax this muscle. Or you can pinpoint the pec minor, lift the arm up slightly and stretch it out. Do a pin and stretch. This might be a little too painful for most patients, so just keep checking in. If their shoulders are really rounded, you might want to work on their scalene muscles, which are located here on the front, on the side, and on the back of the neck. Often the anterior scalene muscles on the front get tense from how your client is breathing. If they're feeling really stressed, they'll be doing more shallow breathing, so they're using their scalenes and upper traps to lift the rib cage rather than doing deep breaths with their diaphragm. But this is also a sensitive area, so you don't want to use too much pressure because that might cause some very sharp nerve sensations down the arm or up the neck. Even though we've already done it, I like to always end my neck massages with about 30 seconds to a minute of traction. If my client comes in with a headache, I usually finish off with some temporalis work. And some flushing. That concludes my neck massage tutorial. If you enjoyed it, please remember to like and subscribe and share with all your massage colleagues. Stay stoked!